So with that, let me touch a little bit about neoadjuvant chemotherapy. And this is looking at neoadjuvant chemotherapy plus surgery versus radiotherapy, and this is the evidence that we have from several of these papers. And this is 21 randomized clinical trials involving 872 patients, and this is published in the European Journal of Cancer. And what this actually showed was there was significant reduction in the risk of death with neoadjuvant chemotherapy, despite some differences in the design and results of these trials, but this did have a significant p-value of 0.0004. And what was important was that the timing and the dose intensity of the cisplatinum based neoadjuvant chemotherapy had an important impact on the level of the benefit that was seen with these cervical cancer patients. Again, this is just showing you the trial characteristics, the various chemotherapy agents that they used, and what was important is that all of them did have cisplatinum as an important component of their chemotherapy regimes. So this is again a forest plot to show you that neoadjuvant chemotherapy definitely helped in having better survival outcomes for these patients. This was looking at the results of all the endpoints in terms of survival, overall disease-free control, loco-regional disease-free control, and metastasis-free control. For all this, you can see that the first three parameters have a significant p-value here, whereas for the last one, it was not so significant. Again, if you look at survival by stage, you can see that for the earlier stages, the survival is much better than for the late stages. Logic definitely says this has to be the case. And if you look at the absolute effects on survival, again showing you that the absolute benefit at 5 years for stage 1B and 2A is 12%, and for stage 2B is 14%, and for stage 3 it is 16%. So the change that has occurred, you can see the numbers here. After adding cisplatinum based chemotherapy as neoadjuvant, we have made a change of this much here. So the summary of all these studies is that for all endpoints, there was highly significant substantial improvement with neoadjuvant chemotherapy, and again important to see that these results are fairly consistent across trials. So a little bit about the discussion for all these neoadjuvant trials is that we know that these numbers are relatively small and there is some heterogeneity. Some of the trials, that is 4 of these trials, used pelvic radiotherapy in the surgery arm. In fact, one trial also used intra-arterial chemotherapy. But there is a definite indication that neoadjuvant chemotherapy plus surgery could be the possible role to be taken care. Now this is neoadjuvant chemotherapy followed by surgery. There are 2 randomized phase 3 trials which are ongoing, and these will probably address this in a better way. One is from the NCI. This is another EORTC study which is looking at neoadjuvant chemotherapy and surgery. And in fact, in our own country, Tata Memorial Hospital is also running a study which probably will answer this question in the near future.